Hello and welcome to another episode of a podcast where we explore the latest innovations and insight in healthcare. I'm your host Farooq Sheikh, and today we will be talking about a very niche yet vital part of our lives that often goes unrecognized. Before we dive in, I want you to imagine a world where life-saving medical supplies arrive just in time, even in the most remote corner of the globe. This timely delivery can be a life-saving point in our lives. From the chaos of emergency situations to the routine delivery of essential medications, healthcare logistics is the backbone that ensures everything runs smoothly. To delve deeper into this topic, we have a very special guest with us today, Mr. Kishore Mannepalli. Mr. Kishore is the founder and CEO of Total Emergency Network and an expert in healthcare and medical logistics. With his extensive experience and innovative approach, he has been at the forefront of revolutionizing how healthcare logistics operate, ensuring efficiency and reliability in critical moments. So, without wasting much time, let's learn from our guest about the intricacies of healthcare logistics, the challenges faced, and the future of vital industry. Kishore thank you very much for joining us today.
Thank you, Farooq, for giving the chance to participate in your broadcast. Thank you for this opportunity.
Thank you, sir. Thank you very much. And before we start, how was your day, sir? All good? How are you? How are you feeling right now? Thank you very much for giving your time, actually.
Yes, I think as you know, I think all founders are, I think, hectic in doing something that is the helpful for the society as well as the startup. And we are also the same thing. We just launched an activity in the T Hub, and just now I think I came back from that meeting.
Okay, great. So, sir, let's start. Means I want to ask you a first question. That is, what are the biggest challenges currently facing healthcare logistics, and how are they being addressed?
Okay, so that's a very interesting topic because I think from that only I think we started our total emergency network. So before that, I think I wanted to give you the classification of healthcare logistics. So there are two classified into emergency patient logistics and non-emergency patient logistics. Okay, in emergency patient logistics, we call it as a anybody I think who is transported from accident site to hospital, that we classified as a emergency patient logistics. And in case of non-emergency, there is a, like I think scheduled doctor visits, chemotherapy packages, the dialysis. These are like I think patient centric the logistics. Apart from that, we have another classification which doesn't touch the patient directly. Those are like I think medicine delivery, the medical equipment delivery, and even some kind of diagnostic test, all those things. So
Okay,
since our company like 10 is concentrated on the patient-centric logistics, I wanted to concentrate on the emergency patient logistics and non-emergency patient logistics. Okay, so the biggest challenge is here. So I think if you see the data from various research papers, almost like I think 24,000 of people losing their valuable lives every day because of improper or medical assistant in last golden hour. That is, I think, first 7 minutes. So that is the biggest challenge in India because in golden hour, if you give the proper medical assistance, it is like 99% of chance to save that patient. But in India, it is only 4% that is happening. In US, I think it is 59% they are able to save the lives. So that is a challenge, I think, what we are facing in India. And that's the, like, I think, game changer. That's the space, I think, where we are operating right now.
okay, got it. Okay. So you are doing a tough job right now. Means it's very essential to the life. So life-saving opportunities come absolutely essential and very crucial more at that time. And moving on to the
Yes.
second question, sir, can you explain the role of healthcare logistics in ensuring patient safety and efficient care delivery? So what are the major steps? First step when you're getting a call, what are the first step you're doing?
Yeah, the patient safety is very vital part. Like I think, see, even I think if you see our tagline also, there is a right ambulance, right time at right place. Okay, so in the first word is right ambulance, which means that if you send a wrong ambulance to the patient, I think who is suffering from some other injury. For example, I think the patient who has a spinal problem, and if you send a basic life support, you are like I think much worsening the condition of the patient instead of I think supporting that patient. So that is the patient safety. So when we get a call, we understand the what is the patient condition. A patient is able to walk or patient what exactly the patient is required. Based on that, I think we send the ambulance. So that is the first safety what we are taking. And at the same time, I think what exactly we are doing is we are educating all our drivers or like I think all our paramedic on the skills of basic life support. So that is the training what we give to all the. So because of that, it is we call it as a first responder support. So when some accident happens, immediately the driver is the first person to assist the victim. Instead of I think reaching to the hospital and after that I think doctor is taking over the patient. Before that, I think the driver and the paramedic who is in the ambulance, they are the first people to treat that the patient before he reaches to. So these are the like I think some kind of the patient safety activities what we are doing. But other than this, I think we are also ensuring the proper medical supplies. So even I think if we onboard the like patient on the, so if you don't have the proper medical supplies to treat that patient at that point of time, that is also one of the like the setbacks that can happen. So these are the like I think three things what we consider during the patient safety measures.
Got it, got it. So, related to this only, I want to ask uh, Abhi, recently, when we see like one organ from another part of the state is getting delivered to the other part of state. So, all this coordination has been done. It's very crucial, right? So, how those things takes care? Like, you prepare
Yes, yes.
earlier, and what kind of connectivity you do at that time? What are the coordination needed at that place?
Yeah, yeah. See, that organ transport is very, very important. The like transport activity, because I think the organ life is not more than 4 to 5 hours.
Correct.
Okay, so when we have a that kind of request, immediately we activate the green channel. Green channel means the from the airport, I think from where I think the organ is being transported to the hospital, we wanted to have a green channel. So within like I think 10 to 15 minutes, so from airport to hospital, here we wanted to the transport the organ from that place to this place. So in that way, I think what we do is I think we are not only informing the hospitals, we are also informing all the public servants, like I think police, even I think airport authorities, even like I think the receiving hospital and the donating hospital, all those like I think this is the supply chain. I think what we manage when we transfer the organ from one state to another state.
Okay, so it's pretty difficult job and very crucial at that because we have a time limit, right?
Yes, yes, yeah, because I think as I said, like I think it is 4 hours of the living time, and after 4 hours, I think those organs are not the like useful for any kind of the any kind of
Correct.
use.
So moving on, like uh, the data. I'm talking about the data. So nowadays, since the smart ambulance are there right now, which you are operating, you are into the smart or ambulance facility. So you also
Yes,
collected data, right? And I
yes.
want to, yeah. So what the data analytic being utilized to improve healthcare logistics? You provide all those data to the doctors, or how it goes? What is the flow on this?
Yes, yes, that is very, very important. See, when we like, I think pick up the patient from the like home to hospital. So whenever I think the hospital reaches to home, immediately the paramedic in the ambulance, they note down the vitals at the site itself, in the pickup time itself. Okay. And during the travel also, they monitor all the vitals. I think whether the vitals are in the range or like I think it is fluctuating between above and below range. Those vitals, I think they are continuously monitoring. And after once I think the patient reaches to the hospital, so they have a summary sheet. So the at the time of like handing over the patient to the hospital, what are the vitals? So these are like I think at the three various stages we take the data and we supply the data to hospital so that I think they can take the wise decision. So that is what I think happening right now. But I think we are going a step further. Like I think we are integrating one technology with help of IoT devices, so where we can shift the patient monitoring from the pickup itself. So with help of these IoT devices, what we are doing is we have a camera in the ambulance. so that I think the ER doctor can see the patient vitals on patient condition directly from the ER room itself before coming to the ER room. That is one. And second thing is all the vitals are being transferred to the cloud, and from cloud, I think these ER doctor can get the details in the ER room itself. So we arranged a monitor in the ER room so that I think it is like I think from the time of pickup, the doctor is able to monitor each and every vital. So that is the data I think what we are talking about. That is like I think we can say that it is intelligent data and life-saving data for that patient. So that's where I think we are right now.
Got it. Coming on this, the costing part. Okay. So it's very challenging since, for example, like if we say the normal ambulance and the technology ambulance. So what are the people views on that at the current state right now? Because इसको अभी बनने में तो I guess थोड़ा time लगेगा, but still people are preferable the smart technology ambulance, the smart ambulance. What's your take on this?
Yes, yes, I think it is a need of hour, but at the same time, I think costly at this point of time. So as the technology progresses, as the technology evolves, so even I think if you see the green technology also, before this, I think that we are running with the lithium batteries. Now I think we are going to another technology which is giving the cheaper. So now we are also moving in the same direction. So before this, we were having some kind of routers in ambulances, which are like I think costly. At the same time, I think each and every ambulance should have that router. But now I think what we are doing is from the router technology to now we are going to the cloud technology. Cloud technology means you don't need to install any kind of the hardware devices in the ambulance. So that I think the cost of the hardware devices that is going to come down with the help of the cloud technology. So in that way, what we do, so the technology now it is in a test mode. So they are testing. So there are so many players in this space, and they are testing right now. And we are also engaging with multiple players to validate that technology. Once it is validated, I think it is going to become a much cheaper. I think I cannot say that it is not costly. I think it will be costly, but it is cheaper than whatever the costing we have 6 months back. So that is how I think the progress is happening in that space.
Noted, sir. Noted. Now coming on the government sector part, I just want to know that our government doing some kind of research or supporting these smart ambulance techno feature currently, or still they are not so much aware and not what is currently happening in that government affairs.
Yeah, I cannot say like I think government is not doing anything, but I don't have much data to say that statement. But at the same time, I think if you see the Telangana government, they are running a T-Hub, and in T-Hub also they are running a program called Healthcare Cohort. So to encourage the healthcare startups. So that's where I think they are putting like lot of interest and lot of funding, so that I think instead of I think directly engaging the funds into the activities, they are encouraging the startups to develop all these kind of products. So
Okay.
in that way, I think I can say that I think government is also taking some kind of a part to develop all these technologies, not directly and indirectly they are supporting us.
Got it. Got it. Got it. Sir, can you share some examples, your personal experience on the healthcare providers and logistic companies working in the tandem or those like simultaneously on this project? Any kind of particular project? Do you have to share some example on that?
Yes, yes. So recently we tied up with one of the like a 300 bedded facility hospital in Hyderabad. I cannot name it, but it is already there in the news. But what they have done is they have created a trauma network. So in around Hyderabad. So what they are doing is, so we have supplied a ambulance network, 10 ambulance network. So it is like I think total emergencies, 10 aggregated ambulance networks we have supplied to them. And what the program is going to offer is, so they are going to be stationed in a different locations of Hyderabad to cover the incidents or accidents, whatever happened during that area. Okay. So these all 10 ambulances are equipped with the latest equipment and the latest manpower, so that I think any incident happened in the area, immediately that ambulance goes and picks the patient. So in that way, I think what they are doing is, so it is like, I think, asset light ambulance network, what we have created to support the patients as well as the hospital. So it is like, I think we can say that it is like, I think, corporate social responsibility. At the same time, it is like we are protecting the people with the latest technology or latest equipped ambulances by placing them at a strategic locations.
Noted,
So
noted,
that's how
sir.
I think, yeah, that's how I think the hospitals also, like, I think, expanding their modus of operandi to save the people who are in the needy.
Perfect, perfect. And that's the need of the hour at that point of time, because
Yes.
patient life is anything, कुछ भी important नहीं है life के अलावा, right? So,
Yeah. So to add on to that, like, I think, see, as you said that, I think these emergency logistics are very tricky. So these are like, I think you don't need every day, but I think whenever I think they need, if you are not there, I think you are nowhere. So that is the trickiness of this particular field. So that's why I think the normal logistics and healthcare logistics are different in terms of, I think, emergency healthcare logistics. Normal logistics, you have it like in some kind of demand pattern or demand forecasting, but in healthcare logistics, it is completely different. It is like, I think, demand drives the supply. There it is like supply drives the demand, but here I think demands drives the supply. Whenever I think it is required, you should be there. So otherwise, I think you are not there in the total ecosystem. So that's how I think it runs.
absolutely, absolutely. Moving on, I want to ask about the corporate segment. Nowadays, most of the corporate companies are also preferring to keep at least one ambulance, the smart ambulance, in their premises. So, are there like any steps taken on corporate segment also? Corporate companies are encouraging these things, or still nothing as compared to the means when we say the corporate are not much involved in this segment.
Yeah, it is like, I think, a mandatory service for any corporate sector. It is my opinion. Because see, nowadays I think because of our like health habits or like whatever the lifestyle habits, nobody is guaranteeing their lives. I think because of so many things, I think all of a sudden, I think 40 years person, I think falling prey to the cardiac arrest, or even I think 25 year old person falling apart. So, because of these things, I think nobody can guarantee that what will happen in the next minute.
Right.
So, in corporate sector, I think if you see that also, if an important person, like, I think if a senior decision making person fall immediately, then I think it is going to be very big problem for that particular company. So in that case, I think it is like, I think it is not going to happen, but I think if it happens, I think it is a big loss to the company. But all most of the HR, like, I think most of the admin people think that, I think, okay, these kind of incident doesn't happen regularly, so why to keep the ambulance? But whenever I think it happens, it is going to cost that organization like anything. So that's why I think what my suggestion is, I think don't see the like a penny, whatever I think we are putting into that, but I think it is advisable or it is mandatory to keep the ambulance whenever I think that the organization has a more than 500 people in their premises. So I think we should encourage such kind of a companies, I think, who can park the vehicle for benefit of their employees.
Very well said, sir. Very well said. Because we say now as a prevention is better than means disaster,
Yes.
right? So we should
Yes.
understand all those things. Now, coming on to the most means, we have already covered the government segment, how the logistic care works, and the corporate segment, all those things. What do you see from your point of view? What trends do you see shaping the future of logistic in the coming future?
Yeah, so the future of the logistics is very, very important. So right now, I think we are in a stage that I think if an incident happen, so from that incident to hospital, I think we don't see any treatment that is happening. So that we call it as a like the treatment begins from whenever I think the patient reaches to the hospital. But in coming days, it is going to happen at the time of pickup only. Pickup means, I think, if a person like if a victim is suffering from some kind of injury, so ambulance reaches to the location and immediately from that point itself, the treatment is going to happen. So how it means that the IoT is going to become a critical technology to make it happen. So even I think with help of like video calling or with help of these IoT technologies, we are also equipping the all the ambulance with all these devices. So in order to show the like I think patient directly to the doctor at the time of pickup, or like I think before the ambulance reaches, I think we connect the patient with the doctor at the ER room through WhatsApp calling and everything. So in that way, I think it is like I think before ambulance reaches to the patient or before ambulance reaches to the hospital, so the treatment should begin. So that is the way forward for all the like medical logistic companies, because I think the treatment should start from the next minute of the injury. So
Correct.
that's where I think we should go going forward. Going forward, we should see that.
Correct, sir. Correct, sir. One more thing I want to ask, sir. ये जो Western का means the smart ambulance features, it is, I believe, it's already present in the Western segment, right? Western countries. So we are
Yes.
still new in this segment. Right? India is still evolving on this segment, right? So what are the difference you see when it comes to comparing the Indian medical emergency segment, the and Western segment?
Yeah. So we can say that I think standardization. Standardization means, so in India, I think we have a ambulance protocol called AS 125 that is given by the our Indian government. But apart from that, every ambulance is equipped with the different designs, and every ambulance has a equipment of a different companies or different manufacturers. So until unless I think we have a standardization in the ambulance, at the same time, I think in the medical equipment, we cannot have this kind of a standardization with the hospital also. Because I think if my ambulance is having some monitor and other ambulance is having some other monitor, then I think the connecting the technology with that ambulance to this ambulance, it is becoming difficult. So now I think what we have to do is to make it to the that level. What we have to do, first of all, we have to standardize, and we need to get some kind of a guidelines from the even I think government, or like I think the top bodies. So ambulance should have all these minimum things. Then only I think we approve this kind of a this kind with this. So then I think we will have a some kind of a standardization at the ground level. Then I think we can stress upon like we can I think reinforce. Okay, you have to use this kind of a technology to transfer the vitals from ambulance to the hospital. So that is the second level. And third level is even I think we should have a, some kind of standardization at the hospital, so that I think to get the technology at the hospital level, it becomes very easy.
Very well said,
Yeah.
sir. Very, it's on point. It has to be done. It has to be done. It's a need of the hour, and before means it's very important. Still, I
Yes.
don't understand. So, what's your views on this? Why the people are and the corporate companies, government, is still not supporting this? It's very important, and we have seen like we are the support which the emergency segment, the smart ambulance should get. Still, I don't see. And what's your view on this? The people are not supporting, and the investors are not coming on this part.
Yeah, so as I think we discussed in the last 10 minutes, so it is like I think until unless something happens, nobody is concentrating on this kind of technology. So, and the number of incidents that happens in one place, it is like I think if you take the total India, the numbers are very big. But I think if you see the segregated numbers, like I think in Maharashtra, I think the number of incidents are small, in Delhi small. So this the cost of deploying all these ambulances are going to be huge, because I think we are a very big country, and if we have to save that each and every people, we need to deploy a lot of ambulance at lot of even I think when we onboard the ambulance, what we do is we onboard the ambulance according to the pin code. So if we have to do it will be huge capital to be like infused into the system. Okay. At the same time, I think the rate of return, like I think if I have a one smart ambulance in one area, the number of incidents happen in that particular area, it is not going to be very high. So ultimately, it what happens is if it is covered in public health care system, then it makes sense. But whenever I think it comes to the corporate, it doesn't make any sense on a ROE basis. Return on
Right.
investment is not going to be very good. So that's why I
Right.
think most of the companies or both of the corporates are not willing to go, I think, for this program.
Absolutely, absolutely. Thank you very much, Mr. Kishore, for sharing your invaluable insights and expertise on healthcare logistics. It's clear that work being done in the field is not only fascinating, but essential to the well being of countless people around the world. To our listeners, I hope you found this discussion as enlightening as I did. If you enjoyed this episode, please subscribe, leave a review, and share it with your network. Thank you very much for tuning in. Stay tuned for more episodes where we continue to explore
Thank
the
you.
latest innovation and insight in healthcare. Until next time, this is Farooq Sheikh signing off. Thank you very much, sir, for your valuable time. Thank you very much.
Thank you. Thank you.